I'd like to give you some points about the Arabian horses, and I hope with the end of this lecture you'd like to own an Arabian horse and be a horseman. So, as you said, I've been working for Al Zahar stud, which is the oldest Arabian horse stud all over the world. Maybe she was founded like 1898 and have been transported to its current position since 1928. And the horses there goes back to the ages or the eras of the Pasha and Muhammad Ali Pasha that collected the Arabian horses through the Arabian Peninsula and inherited them since when. So the Arabian horse, we're going to talk about the Arabian horse industry in Egypt. Some important points that may cover some of the problems that we have in the Arabian horses or we face in the Arabian horse field in Egypt, and as well some point about the Arabian horse. What's the Arabian horse and why we say it is Arabian? How we judge it? How we say the beauty point of the Arabian horse? Otherwise, the management system and the used equipment here in Egypt. And then we'll talk about some of the clinical problems that we have. And at last, we have to evaluate and score the biosecurity score in my farm. It's the most important thing. If I don't evaluate what's going on in my farm, so I'm not controlling it. Maybe I have an infectious disease and I don't know why. So that's a very important thing. So can we start?
Please go ahead.
Okay, perfect. Okay, first, the Arabian horse. It's maybe the oldest known breed, and there's the oldest documented photos for the Arabian horses are documented in the pharaonic tombs. It started like in 1496 before Christ, so it's so old. And then in the modern history, it was started by Muhammad Ali Pasha that started to collect the Arabian horses to Arabian Peninsula, as we said, and he preserved them from extinction and started to document them. So that's the first thing that it's a characteristic for the Arabian horse. It's documented, so we can know every ancestor of the horse we have, maybe for like 10 generations or something like that. And then his son Muhammad Pasha Awal, he started to go on with the horses until they reached to Al Stud, as we said. Those we inherited the horses of Muhammad Ali Pasha. Okay, first of all, the Arabian horse is something unique, another other than any other breeds. Has some characters like intelligence, beauty, agility, and stamina, and so that's what differentiate him from other horses from other breeds. It's everything that he had in his beauty characters has an influence on his performance. So we can see some points that how we say that's an Arabian horse, how this reflect on the performance of the horse. Okay, first, in the Arabian horses, we judge them mainly on 5 points. There's the 5 points that we can say that's a good horse, Arabian horse or not. First, the head and neck, then top line or body, and legs, movement, and type. And type may summarize everything about the Arabian horse. So I will discuss every point in details. The head of the Arabian horse, there is some point that 5 points as well we can see in the Arabian horse head. First, the eye should be great, round, black, don't have white like human eye, so it's considered a defect if we have white in human eye, like human eye. Should be placed on both sides so we can the horse can cover a wide range of vision. As you know, a horse is a prey. In the wildlife, the horse is a prey, so he should have a wide cover to allow him to escape from the predators. So that's why it should be placed on both sides, and even when the position should be like 1/3 the ears, and 2/3 to the nostril. Then the jabha or the forehead should be straight or slightly concave, and the cheekbone should be well developed and prominent so that he can allow him more to masticate more, and then the digestion could be better. Nostrils should be fine skin, dilated nostril, so he can inhale more air, and even so that the mouth itself should be like square, so movable, so he can pick up. The normal habit or the normal inhabitants of this horse is the desert, so he can pick fine plants while grazing. At last, the ears should be small, leaf-like shape, positioned close to each other, so it acts like a radar, so he can locate if there's any predator around or something, so he can locate it. So that's the head of the Arabian horse. That's the main point, and how we see the Arabian horse's beauty, and then how it reflects to its performance. And by the way, this is a picture of all the pictures here are used from Azhar sub that horses. So that's one of Azhar sub horses. There is a tactile hairs around muzzle and around nostrils. This allows him, because if we see the range of vision of the horse, so this is a blind area, and in penis, the chin of the horse, it's a blind area. So to detect subjects around this, if there's a rock or something like that, so he can detect it by this tactile hair. So that's important, and that's one important thing that strictly we don't allow shaving these tactile hairs in the beauty shows. Then the neck, as you see in the picture as well, the neck should be refined, triangular in shape, should be well set on the shoulder, have a fine mizbah or throat lash, so it doesn't suffocate him while running, so can be run more and inhale more air as well. The body has several points. First, the Arabian horse should have a harmony in its body. So there's three parts: the body, chest, and back, and quarters. The three parts should be seemingly equal. Um, for example, if we take the chest, it should be wide with a good shoulder, broad shoulder, and with good angle, like 45 angle. If we just draw an imaginary line from the point of shoulder to the point of elbow, descending from withers, so it should be like 45 degrees. So it will allow him to cover more area while moving, and as well the good muscles will make him cover more space. And then the back should be short enough to fit saddle, not too long as it will be a stress on its back. And by the way, the Arabian horse is characterized by the lumbar vertebrae. It's the last lumbar vertebrae is somehow fused together. And at last, the quarters, the croup, it begins from the point of hip to the point of tail from the back. So this is considered like the engine of the horse. It gives him the impulsion while moving, and then we'll just talk about the movement later. So that's a good Arabian horse conformation, good body. And this is a chest as well. And now you can see the type and the presence of the horse. He's presenting himself. He's interacting with the photographer, and his intelligence is obvious in his eyes. And then the legs. The legs have so many points to talk about, so we can just summarize them about if it's correct or have defaults. The correct leg have a good bones with good proportions. The forearm should be like 2/3 of the cannon bone, and the pastern are not too long, not to be too slopey, so can make strain on the tendons, and as well it should be there's no tied in tendon, below the knee, and even the angles of we just have when we have a look on the horse from front. So it should be like a parallel from, if we have an imaginary line from the middle of chest to the middle of knee, the middle of hoof, it should be parallel. Any deviation from parallel lines, it's a default, like here, it's like shown here. So that's the legs. The movement of Arabian horse is something very characteristic for the Arabian horse, especially the high tilt while moving. He's just putting his tail back on his back, so you can see like it's a flag. There's also 5 points or some points that should be covered in good Arabian horse mover. First of all, the impulsion, which give him a push while moving, extension or coverage, more space, moving his forelegs so he can cover more space, rhythm in the movement, at least six. When we see it in trot, so trotting him should have a rhythm in the movement, not less than six paces in the same movement, not moving 2 paces or 2 strides and then go counter. So that's a very important point in his movement. And at last, suspension, which something like he's suspending his body and legs in the air. He's like flying. So that's very characteristic when you see it's a Arabian horse. And at last, type, as I said, type includes everything about horse: the fine skin, the prominent blood vessels, the superficial blood vessels, even if the black around the eyes, the black around the muzzle and nostril, it's gray. So it's something characteristic for the Arabian horse. And even and at last, the tail set, everything in the Arabian horse uh, form the type. The head forms the type, it's a part of the type. The movement is a part of type. Even the tail set is a part of type. So that's a summary about Arabian horse, how to differentiate it from other breeds, and what's the most important characters of the Arabian horse. And then we'll talk about some of management practices that are present here in Egypt. We'll also try to summarize them and the different regimes or systems that are used in different forms here. There's some points we'll take about the management practice. Management practice includes housing system and the type of housing, even the first type of housing, and then the bedding used and ventilation of this house. Then the feeding and nutrition of the horse, the hoof care, deworming, the preventive medication like deworming and vaccination, and at last, the exercise. Well, first of all, housing. There's three systems that are used mainly in Egypt, depending on the number and use of horses. Housing in a group housing in a barn, they are all together, and it's mainly used for mares with their foals. So the house you can find like this. The house, it's an open one. They are all together inside, and then it have a different, like another barn, another playground outside this barn. So you can put all the mares together with their foals and let them loose together. The other system used, it's a loose boxes, and it's mainly used for stallions or maybe the other wheelings or those horses that have a mare which is separated with her foal. So every horse is put in a separate box, and this is another system used as well. And there's a mixed system, like putting the horses in a loose box inside barn. All the boxes are collected together inside barn. So we can put them in separate, everyone separate, and as well they can communicate with each other in vision or in olfaction. So that's another mixed system. Then the bedding. There's two main types of bedding. There's too many things that can be used as bedding, but mainly there's two main things we use them for bedding: the straw, the wheat straw or rice straw, and the wood shavings. Okay, every one of them have advantage and disadvantage from each other. For example, if we can straw, it's more economic, not expensive like wood shaving gas. It's considered as a source, an external source for fibers. So we have noticed that less behavioral pattern and behavioral abnormalities in the horses. Their beddings are straw because of some of the bad habits of the stable vices in the Arabian horses, some of them due to low fiber. As for example, the trichophagia, which is eating his hair, is the hair of the tail, and maybe lignophagia, which is eating like the wood material in any wood material, maybe in the playground or something. So this is the main things that compromise or indicate there's a fiber deficiency. So it's noticed so rarely in horses bedded in their boxes with a straw. On the other hand, it has a disadvantage, the straw, which is an advantage for the wood shavings. For example, the wood shavings have a more absorbent power. So if the horse is stable for overnight and there is urine or water from maybe the trough, feeding the water trough or something, the wood shaving had a good absorbance. So we have noticed a less hoof problems in horses bedded with wood shavings. On the other hand, as well, the straws, the straw is a bad absorbent, so you can see a canker or things like that. Then the ventilation, it depends on the height of the ceiling, the shape and size of windows and distribution. And there's examples for the ceilings, and at least should be at least 4 meters height. The windows should be distributed on both sides of the barn to allow more air current. So if there's a stable, the ceiling is not high enough or the winds is not distributed well, so you can notice many problems in respiratory, like respiratory or this related to the bed ventilation. Then we'll talk about nutrition. It's another important point. Here in Egypt, mainly the horses have two main objects in feeding: roughage and concentrates. Okay, the roughage is the green one, and the concentrate is so that we have, like we will explain. For example, first let's talk about roughage. Roughage, it depends on the season. On season, as for the winter, we have persimmon or alfalfa hay, the alfalfa, and in the summer we have a hay, which is dried alfalfa or dried persimmon. Uh, uh, that's we can use this. It's so satisfactory in horses kept for maintenance. We don't use them in riding or in breeding or any other purpose or training. So it's enough to feed them on roughage. But it's not enough at all if we are using the horses for other purposes, as for example for breeding. The pregnant mare or nursing mare should have more energy. So and as well the breeding stallion and the training horse, if we are going to train or will participate in show or something, so should have more another source of protein and energy. So we use the concentrates. Concentrates, there's two main things used. We can use them as a natural source, like we put barley, and then make some additions like soybean meal, bran mash, in a natural form, and in the proportions or percent that are used separate to each horse according to its weight, according to its size, according to its use and performance and exercise. So this is a point to determine how much should I put or add to the horse in his meal. And there's another form. We put the millet, the pelleted food. That's pellets mix. So it's mixed together and compressed in small pellets like that. This is the roughage. On the right here, you can see the persimmon, the green one, and when it's dried, the hay. It's another form of it in the summer. And here you can see the concentrates, like the barley on the right and soybean meal on the left. It's the barley is a good source for energy, for nursing mares, and there's a soybean meal. It's a good source for protein for training horses. And here's the pelleted food. They are mixed and pelleted and converged together. So it contains everything. We can put vitamins and any additives on this pelleted food and mix together, and to be served like a ready form. So that's another form. Everything, every point on this nutrition will determine the body condition score of the horse, and as well it will reflect on its performance. And as well, for example, there's an advantage and disadvantage for everything. For example, the pelleted food has advantage that it contains all the minerals and vitamins mixed together, and there is no deficiency that may we face in the other natural form. But on the other hand, the pelleted food have a problem. We noticed there is a high percent of choking when feeding the pelleted food because of its ability to swell when it have water. So with eating in a bad type or bad quality, if it's bad quality, makes it pelleted food. So it absorbs water more in while digesting or while masticating. So it swell in the esophagus and make choking. So that's a main point we see in main drawbacks in feeding the pelleted or mixed food. Then the hoof care also it depends on the type or the use of the horse. For example, in my farm, we don't use horses in racing or jumping. It's a breeding stud, so there is no strain or no stress on the hoof, and so they are left unshowed. It's maybe we just can leave them as shown here in the picture without showing. We just trim the hoof every 30 to 40 days, regular, to preserve the angle, which is 45 angle in the forefeet and 55 in the hind feet. So we keep it in the same angle, not to make a strain or stress on the tendons. Using some basic instruments like the pincer here on the right, and then the knife and the rasp to just to preserve it. Showing horses, we're not using it so much, only if there's a medical purpose or there's a problem in the hoof, so we use it. While in the other horses, the equestrian horses or the sport horses, it's mandatory to use it. So because it's using it too much to take care of the hoof, it's showed regularly. Then deworming. Deworming is it's a very important point that some owners may neglect it, and they just when they just walk on a disaster, they know that they neglected this the deworming. So it's something hidden that sneaking around we should be care about, and don't forget. There's some types of dewormer used. Here we use two main things: benzimidazole, which is fenbendazole or albendazole, and ivermectin and moxidectin. That's a newer generation of the ivermectin. There's another one used in horses by rental, but it's not available while in Egypt, the pyranid pomade. So it's not available. So I just wrote the available forms: benzimidazole, fenbendazole, and ivermectin, and it's a newer generation moxidectin. So this is the two types used of the dewormer. There's a many regime or system in deworming, depending on rotation of the type. The importance of rotation, not added to develop a resistance against this worm. The worm can develop a resistance against this type of the dewormer. So there's some forms don't make a rotation at all, no rotation. Just use a single type every time. And as we said, that have the disadvantage of making developing a resistance. And there's a slow rotation, like using 1 year we can use a type, and in the other year we use another type. And there is a fast rotation, and it's better thing. It's the best because of using a different type every time. Maybe cover a more spectrum against the worms, so it's gonna be more effective. Um, mainly the regime used, there's differs according to the age of the horse. As for example, the adults, we use it every 6 months. It's enough because it's the more resistant. And in the foals, every 2 3 months is maximum. Begins from 4 months. Maybe we can begin from 2 months, but it's if the mare is dewormed already, so we can just use it 3 4 months to start, and then every 2 3 months we use the dewormer. The ivermectin or moxidectin, it's preferred to be used in summer because there is a problem of hyperemiasis. The hyperemiasis is some kind of worm transmitted by fly can cause a problem in the skin. There's a cutaneous or eye hyperemiasis. It mainly lives in the stomach, so the ivermectin is effective, and its new generation as well is effective against this type. So it's preferred to be used in summer. Then the vaccination. Vaccination, the available vaccination or the vaccinations that should be used. We have bacterial and viral against bacterial diseases and viral diseases. The bacterial diseases, there's strangles and tetanus toxoid. The strangles is not so effective because strangles, we can just talk about it later in this lecture, but it's not effective because it's in drops to be put in inside nasal drops. So it's not effective to hold all horses and give them, and it's not widely used. We don't use it. It's just maybe available sometime. It was been available, but we didn't use it. Tetanus toxoid, we use it. It's good to use it to cover if there's any wound or any delivery of the horse until the mare's giving birth. So covering if there's any accidents. So it's used in the first shoot and the booster, and then annual. On the other hand, the viral, there's two main viral diseases that are affecting the farms here and causing economic loss. Only three. Influenza, equine influenza. The last episode of our outbreak of the influenza have been like 2008 or 2009. That was an outbreak all over Egypt in the horses. The influenza doesn't cause mortality. Mortality is so low, and sorry. Influenza is high morbidity, highly infectious, infected all horses, like 90% of horses, but low mortality. The other one is equine herpes virus. That's the most important one because it has many forms. It has a respiratory form, which is the least one, and have a portion form. The portion form causes an economic loss. Imagine that you have a mare and you had it pregnant and waiting for the foal, and maybe after 7 months or 8 months, she aborted. So it's economic loss. And at last, the biggest problem is the nervous form, which is have put bad prognosis if not treated as early as possible. So that's a very important thing the problem that in this virus, the herpes virus, is as you know, it has a latent infection. So then maybe the mare or the horse is apparently well, there's nothing, and is shedding the virus and spreading it. So you don't even know if your horses are infected or not. So it's a mandatory regime to use. That's the most important vaccine in Egypt because of the high population. Maybe in some farms or maybe in the same street, you'll find like 10 or 15 farms together in some places, of course. So there's the most important one to use to control the spread of this infection. And at last, something it's not we don't see it regularly. It's some sporadic cases, the rabies, but it occurred. We saw it in rabies in Arabian horse, especially in those farms that are open and they're living. That there is a stray dogs going in and out. So we solve this problem with raising the awareness for the owners. Maybe it's controlled, maybe it's years now we didn't see a single case, but we just in case we like to use it, just in case we'll never know. You'll never know. Maybe a rat transmitted, the rabies. So it's better to use it as a regular case as well. We have other rabies vaccine. Of course, it's a separate vaccine, but for other herpes and influenza, they are a mixed a polyvalent vaccine, which is used in the first single shot, and then the second shot to the 3-4 weeks of booster, and then annually. And for the abortion form, there is a separate one for the abortion form with high performing unit. So it's giving a more protection against abortion. This is the other one is the respiratory form and nervous form. The last point in exercise in the management system is exercise. Exercising the horses is a very important thing. The horses are born to let loose, to be free, to run, to just to have an exercise. So some point or main regimes or for exercise. The first one and the most important and the common one, we let the horses loose at least for 2-3 hours at least in a day, and in the summer maybe in 2 periods because of the hot weather. So we can leave them in the early morning, in the very early morning, and then late like at dawn. So this is that's something we're not talking about should be done. And extra things that are used in stallions, lunging them or just moving them on hand. Sometimes some owners use this water to have a water truck or swimming pool for the horses to put them around to move in the water. So large paddocks, it's a mandatory to be the horses to be let loose in these paddocks daily. Otherwise, we can see problems like colic, like laminitis. So that's mainly due to, and there is a lot, of course, of the bed-based stable vices. It's shown in the horses that are let loose for a short period per day. So that's a very important point that some owners neglect, but it's reflective on the performance and on the horse and the performance of the horse. Well, the health condition. Of course, we will not cover all the health problems that are seen in the horse, but I'll give you a hint on the main problems we have or we see in too much cases in Egypt. So we just try to have them in categories like the gastrointestinal problem. We have 2 main problems we face: colic and diarrhea. The respiratory problem in pneumonia and strangles, and the musculoskeletal problem and laminitis and hoof canker. That's the main points or the main problems we see in regularly and larger scale here in Egypt. The gastrointestinal problems we see the colic. The colic, of course, as you know, it's the first killer of the horse. It's a sign, not a disease. So it can have numerous forms and various causes, and depending on the place or where the part affected in the horse. The main sign we see it's rolling around, trying to be recumbent and then stand up, roll as you see. It's a pain, high heart rate, increased heart rate. So that's the main points or the main signs you see in colic. It's we have to determine if it's a surgical or not surgical in the first 2-3 hours of the case, and then if it's surgical, so we refer to a surgical or to a hospital to make a surgery. Otherwise, we treat it. Mainly the colic has 3 forms: flatulent, or obstructive, or spasmodic. The obstructive cause of the colic, it's either intraluminal with an infection, or extraluminal with a volvulus or the susception of a volvulus, or the intestine goes around itself, or other tumors like lipoma. So that's the obstructive form. Then the flatulent form, the flatulent may be primary due to feeding on a green forage, which is wet, so it produces gases, so make a primary flatulence, or secondary due to obstruction with impaction, so it ferment and produce gases. The last cause is spasmodic, spasm in the GIT, because of it's either primarily for using some medication, like for example turbogestic butyrophenol tartrate, so make a spasm, or maybe secondary as well for because of infection, so make and fermentation, so paralysis and statistics, the movement of the spasmodic spasm in the GIT. Well, then another problem we face, a GIT problem, the diarrhea. Diarrhea differs as well with the age. If it's an adult, it's more serious and more problem. It's called colitis X, and maybe it's partial, maybe sometimes it's not a real diarrhea. It's maybe a secondary to infection. If it's partial infection, we can see like diarrhea. But in diarrhea in the falls have many producing a watery profuse pieces, as you see. So we have many causes. Some of them are non-infectious, like if the full dam in heat, in the full heat diarrhea. The dam is in heat, so there is a hormonal disturbance in the milk, so the foal have a diarrhea. Or nutritional, if we feeding that the horse on a foster dam, or even an extra source, external source of milk, so it can have nutritional diarrhea. Then the infectious, there's some infections in the bacteria, like E. coli, Klebsiella, salmonellosis is the most important or the most dangerous thing. And then this is the bacterial, the viral, rota or corona, as well in the horses, cause diarrhea and severe diarrhea in the foals. It's we just treat it with symptomatic treatment and raise the immunity. So the diarrhea is really is not that the problem unless the dams are not well fed, there is not enough milk, and the foals are born weak. It depends the prognosis in the case. It depends on the case of the foal itself. If it's strong enough while being born, so it will resist. Otherwise, it's prone to prognosis diarrhea. Then the other problem we face in the foals are strangles, respiratory form in strangles. Strangles, it's a highly infectious disease characterized by high fever, anorexia, the horse is off food, and swelling of lymph nodes. And that's the more the characterized the most character in the strangles. The treatment depends on the stage when you diagnose the strangles. If it's in early stage without swelling lymph node and you diagnose it early, so you can use antibiotic before there's swelling or lymph node, but it's controversial. It's not recommended. It's not highly recommended. When the lymph nodes start to swell, so you should give the horse, just give antibiotics and give the horse's vitality, give him food and water, and be aware of not obstructing the respiratory airways. So if there is an obstruction, we have sometimes a tracheostomy or something to allow him to inhale more airs, to preserve it until the abscess ripened and opened. And so that we give some policies to enhance the ripening of the abscess. Whenever the abscess ripened and opened and there is a pus discharge, so that's the first step in treatment. So the horses are healed already. And after healing of the abscess, and with just cleaning it daily and removing any pustures or something, after that the horse have a long life immunity. Almost more all the folds that have strangles and that the lymph nodes are open rarely or seldom get affected again. So that's a very tricky thing in treating the strangles. As well, pneumonia, it's not seen too much, but when we saw it, there's two. We just think in two main things or two main causes. Maybe sometimes viral, but you have to treat symptomatic, and we'll give antibiotic as well for secondary bacterial infection, and maybe a cause of lack of deworming. That's a parasitic form. So if the deworming is something that many vets are not thinking about, otherwise, the bacterial, you don't have. There's a trick here, and the bacterial is some bacteria cause a pneumonia with another form from. There's two forms. Some of them like strep or any other bacterial cause differs from something unique, like it's called Rhodococcus equi. The Rhodococcus equi have a very strong characters that have an abscess inside lung. So there's two lines of treatment. If it's Rhodococcus, it have a line of treatment other than any other all bacterial causes. So it's something to have to differentiate. It will affect the treatment line. So if you are going to use a broad spectrum antibiotic, any bacteria, use a broad spectrum antibiotic. Or the only thing in the Rhodococcus have a special treatment, which is azithromycin or clarithromycin or erythromycin, azithromycin, so that all these macrolates with rifampicin to make it's more lipophilic, so it will take the antibiotic and get it inside the capsule in the lung, so we'll treat it. The musculoskeletal problem base, it's laminitis. Laminitis, it's very dangerous thing. Maybe if it's left untreated, the horse will not start and will not move again. So it's very important to concentrate in its diagnosis and how to detect early as possible. The earlier you detect the laminitis, the better the case. So if it's an acute case, like on the left, on the white, gray mare, so if you found it in the acute case, you can start early, so there's no destruction of sensitive laminae in the legs, so the prognosis is good. On the other hand, if the horse left untreated or unnoticed, and then the acute stage turned into the chronic stage, there is no interference for the vet. After that, it's so limited. The only giving guidelines for the farriers. The main points is to preserve if there is destruction of the laminae and there is a rotation of the third phalanx inside the hoof. It's a very bad prognosis with the time. If not treated with a farrier, it should be have an X-ray, regular X-ray, so to know the angle, the actual angle of the third phalanx or the third bone inside the hoof, so that to treat it or correct the angle regularly. Otherwise, you may penetrate and causing a big problem for the horse. At last, another problem we face in the group housing mares, and the mares are group housed together while using a bedding like straw is a bad absorbent of the urine or the wet condition in the stable. So we can have sometimes the canker. Canker is hoof cancer. It's hyperkeratinization of the tissue of the horny material of the hoof. So it's like cancer. It's a very serious problem. So and it begins all from the wet condition in the stable. So if not, you should be cautious about the small things like that. Then, at last, we should have a biosecurity score. How do if I have farm? Now you have the guidelines if you'd like to make a farm in Egypt. So have the guidelines to how to breed horse or to have horses. Uh, the management practice and how first of all how to own an Arabian horse and its beautiful characters. Then the management practice, we use it and how to go after everything, the main health conditions or problems that may be reflected due to the management practice. So, and how to avoid them. And when they happen, what do you see and how you treat it? Then you have to evaluate your farm. There's from biosecurity perspective. Uh, if your farm is prone to infection or it's in high risk or low risk. Then we made there's a score for that. The score we will give points. There's a main points that should be noticed while having your farm, like 9 points, and then we'll see how to make the score. First, the visitation and client movement for your farm, the boarding of the horses in your farm, or you're putting your horses in a boarding place. Use a number of the horses you have, shows an event you participate or not, and the international involvement. If you use your horses to traveling them abroad or something, type of your business, and the care, the medical care, and the equipment used in the medical care, and at last the vaccination, the preventive program. Okay, how we evaluate this score? We're going to give points for everything. We will explain everything about the farm, and then we will consider it. We will see if it's a low risk or moderate risk or high risk in every point. We will give a point for the low risk and 2 points if it falls between low and moderate, and then 3 points for the moderate, and 4 points if it falls between moderate and high, and at last 5 points for the high risk. So you can just evaluate your farm like the example we have now. First, evaluate the visitation and client movement, your farm. You can determine if you have in low risk, if your horses are your companion animals, you don't have too much horses and they are companions. You live in your property. So the visitors, you don't have a visitors. The visitors don't come to the farm, or you don't show your horses to anyone. So it's close to it on the farm. No one see the horses, so it's on low risk. Otherwise, it's a medium risk if the visitors are limited to people you know. Some people you know, so you just invite them to show them your horses, or may buy some of your horses. It's a limited persons. Or you can consider your farm in high risk if you are encouraging all type of visitors, or you have an equestrian club, so all the visitors are coming, or all the clients are coming to ride the horses, to ride all the horses and have classes or tours. So you have to give point everything. Then the boarding. You don't, if you have your horses in your own property, as we said, and you don't board them, or you don't have a horses boarded in your own farm, so it's a low risk. If there is you have a boarding, but there is no visitors or clients going around and back, so it's a moderate risk. While if you are putting them in an open place in the boarding, or there's a lot of people, as we said, like in a equestrian club, or there are too many clients and buying and selling, or too many horses that come and go outside and inside, so it's in high risk. Then the number and use of your horses. If you have one or two horses, it will make a difference if you have a few horses that are used for your single purpose, or giving some lessons to certain people, or you have a big school for giving too many lessons, or good mares, or study stallion you use, or somebody take it to use it on their mares, or there's too many mares that come to be bred with this stallion, so it's in high risk, performing high risk. Shows and event attended. If you don't participate in shows, it's a low risk, and even you have some shows and or participate in some show or event, but you restrict the housing of your horses or boarding your horses then, and using them in a separate place or putting them in a separate place, not sharing together with anyone else. So it's a moderate risk while putting them in open place or with there's too many horses around and there's a mixture between horses and they are going between each other, so you're falling high risk. Then number 5, type of business. If you don't consider it's a business, you just own them, so it's low risk. If you are putting them in your farm and giving some lessons uh, for certain people as well, so it's moderate. While if you are putting them, you're board and clean and buy and sell and apply and it's an high risk. International involvement, it will make a difference, of course, if you don't uh, travel them abroad, or you travel them for a while and get them back again, or you are regularly traveling them and going from between countries. So it's of course in more risk. Then the care, if you alone carry your horse, or they have hired workers, or too many different people, will of course determine the percent of risk you have. The before last, the equipment. If you own and maintain all your equipment, you don't share them between individuals, so it's low risk. So if you have your own equipment, but you share them between individuals, your own property, but it's disinfected, so it's a moderate risk. While using all the equipment between all the horses you have without disinfection or without control, you are high risk. At last, vaccination and deworm schedule, as we said, if it's vaccinated and dewormed regularly, or you vaccinate and deworm but not regularly, so it's a moderate risk, or the highest risk, it's you don't vaccinate or deworm at all. Then after these 9 points and evaluating what your farm falls in, it's a moderate or between or low or high or whatever, you give points for every point of this. You give a score for every point of this, and then we'll see the sum, the total score. If total score between 9 to 18, so it's generally falls into low risk. You have no risk. You should be, so it's fine. You don't have a problem. You should start to be care about that. If you have like 19 to 32 points, you start to be alarmed, and then you start to be more strict not to go to high risk, which falls. And if you have 33 or to 45 points, you are in high risk. You're prone to very serious problems. So you have to avoid all of the last mentioned points, so that you can avoid any problems or you don't have yourself in troubles like we said. So the main point of all of this, of this lecture, is to making the horse happy. So thank you, and I hope you enjoyed this, and I hope it's useful for you. And thank you. Well done.
So many thanks, Dr. Ayman, for this very nice overview about Arabian horses, and I'm really impressed because all the time we are speaking with the student and say you need to determine the risk and work on this to avoid the problem. And I think your last slide is very clear. You need to vaccinate, you need to deworm, you need to limit visitor, you need to really estimate the risk if you are working internationally or having a big championship. To more which can lead to more problem in your farm. I will ask you. I will start with the discussion, and then I leave the stage for the student here to ask you. You at the beginning, you give a very nice overview about this very nice characteristic of the Arabian horse and how it's look like and so on. I know also that there are a few methods like PCR and sequencing to determine the purity of the genes in order to say this is 100% Arabian horse or not. Can you comment on that?
Yeah, well, there's An international system used for this, it depends like a system like the eyes or something called ISAC system. So this system have put a rules to make the DNA testing. It's sequencing by sequencing, as you said, for the genes of the horse, certain genes. We use it in the Arabian horses, as I told you. The Arabian horses are documented, so we know the ancestors of every Arabian horse. The big difference that every Arabian horse have a documents, they have an identity, have an international microchip number, and there's a parentage testing that should be done. We don't consider it Arabian if it's not the parentage, if we don't have a parentage test. The parentage, there's many labs around the world. We have another one in Egypt here, in the Health Institute in Egypt, in Animal Health Institute. So we make a sequence for certain genes and compare them with the parents to check the compatibility with the parents. If there is a difference in a sequence or an allele of this sequence, so it's not considered. So we have to make the retest again, or maybe you tested another against another stallion if you have something wrong in your in giving the information to the authorities. So we have it, and it's made regularly. We're registering not less than few thousand of Arabian horses every year. We have more than 1,300 registered Arabian horse in Egypt. At least each farm has at least 10 to 20 mares, brood mares, which give birth every year. So the parents just going at regular pace all over the.
Yeah, this is great to know, and how genetics can really differentiate between a real Arabian horse with a good ancestor and not. You in this lecture we give a lot of diseases, but I'm so happy that you spoke about the management and how you need to have a very good management concerning ventilation, housing, feeding, and all these stuff, because at the end this is will affect the overall welfare of the animals. You see, Egypt is a hot country, but Germany is a very cold country. I think the management will be different if you compare hot versus cold country concerning the ventilation. What's your comment on that?
Yeah, of course, because if here it depends on the weather, of course, and the air current, and as well for the population of the horse. So if they have a high population of the horses inside barn, so it's more risk in the problems with ventilation. But mainly due to if you don't use the group housing of the horses, and it's not used in Europe mainly. Maybe in some few state studs, as in Poland, visited the main state studs in Poland. In Poland, Dianov and Mikhailov and Pialka, and there's some of them using the group housing for certain mares. But otherwise, for private breeders, I think they don't use it. So it will make a difference, of course, for housing single horses or housing too many horses together. And the other thing that about ventilation, of course, in hot weather with low air currents, it's more prone to infection, of course. But as well in Europe, if the horses are not left close together or kept for a long time inside, uh, maybe cold weather, they close the windows or the doors. It's not good thing. They should have a time for getting around, and there's ideally mucking out, of course, so the horses will get loose while the daily mucking out of the stable or their boxes. So that will be enough for them because it's not they don't have the problem of the high population.
Yeah, so you're right. And you see, I'm so happy of this lecture because of very important thing is that
Thank
we always, when we speak about horse diseases, we always speak viral, parasitic, and bacterial diseases. But in your presentation or your talk, you give a very nice overview about what we need non-communicable diseases, which it can be from the not good food, not good exercise, and so on. So I'm very happy that you stress on that. And my question is that what is the percent of infectious diseases versus non-communicable diseases you see with your experience as all? Is 50-50, more non-communicable than communicable disease? What do you think about this?
Actually, in the last few years, after the application of the restricted regimes or systems of the deworming and vaccination, now the maybe 10 years ago, there's no the mentality or the awareness of the owners was not like the recent days. So we have too many problems that the spread of the most important, the most dangerous disease, the herpes disease that causes because of the main issue for the Arabian horses are breeding. So it causes a very big economic loss for the owners. Uh, with years around and change of the mentality, they used to use a strict vaccination and deworming program. Since then, we don't see it too much. If we can different or can I give a summary about the communicable or non-communicable, the infectious disease or other diseases, no, the percent is higher in the non-infectious diseases. It's rare to see an infection or I mean outbreak. Maybe some sporadic infection like bacterial due to lack of hygiene, the diarrhea, for example, maybe pneumonia. This is seen more in fools with low immunity and with bad hygienic measures. If they don't strict the hygienic measures in a good way, so that we can see this infectious disease, but it's not, or not infectious. It's not, there is no outbreak. That's what I mean. But the main problem now is the other diseases that are mainly due to the bad management system. That's why I concentrate on this. Here in Egypt, the colic is the most important, and there's too many. That's the dangerous. The most interesting here is colic. After that, the laminitis. So this is the two problems that cause an economic loss and problems for the owners now. But the other infectious disease, it's under control because of strict vaccination program, especially for influenza and herpes. This is the most important thing. And as I said, other infectious, it's some sporadic cases, not outbreak.
Yeah, so many in these horse. So can you comment, Dr. Ayman, on that difference between, because I know that you are involved internationally in many championship and many evaluation panel for Arabic horses, not only in Egypt but in Europe and so on. So can you say, okay, what you can see in general as differences from the country side or from the country point of view? Because you are working more now in international community, so I think you are exchanging experience with other manager in other farms all over the world. I'm not hearing you, so I think there is a.
I'm sure I missed that the connection was lost. Maybe you could repeat it.
Yes.
I'm sorry, the connection was lost a little bit.
Yeah, what I'm saying is that what do you think, because you have created a very good management system and Zahra farm, and then what do you think from point of view about the international rules is different from country to country, because you are traveling a lot and then you have this international experience? Do you think that, for example, in a country like Dubai is very hot, and in country like Germany is very cold? And also, if you go to the US, you see there are having many more diseases than what we have in Egypt. So what do you think the difference is here?
Actually, it differs. Of course, it differs, but it's not a big difference as you can imagine. For example, because of the management system or the husbandry system, almost the same in all countries with small differences. For example, in Gulf countries, it's hot, very hot, so they don't get their horses outside in the morning. They put them maybe in the evening while there's no sun. The problem there, it's so all over the day. You can see some problems which is related to low photoperiod time in the mares. So that's one of the problems for the hot weathers. If the horses are not, if the barn is not well ventilated, so you'll see a problem of dehydration, and then subsequently you'll see a problems of colic. So that's a main problems there. Uh, somehow in Egypt we have like a moderate, because it's a moderate temperature, so we don't have these problems so big like the Gulf areas or so low in the European countries. So we can see there is we fall in the middle between this and this. Uh, but in the other European countries, maybe it's also differs, as we said in the biosecurity score, differs with the number of the horses owned and the type of business, and if I'm using them, the type of use of the horses. So mainly in Europe, because I know maybe the cost for having a horses is more expensive. So of course you don't have. I think there's no too many for people I know, my friends, not too many owners that have many a bigger number of horses. Not too many. I don't. Maybe the most of the owners I know, they don't have that big number. They have a limited number. So with limiting number, low problems, no or low problems. On the other hand, in Egypt, maybe it's not so expensive to have horses like in Europe, so they are having a number of horses. Maybe in the same farm, find more than 200 horses. For example, in the Zahra, we have a 500 horses. So with increasing the number of the horses, they're increasing the demand for the food, and there's increasing the demand for the caretakers. So if you don't have these bigger, it's a factory, like factory. If you don't have a big number of the caretakers, and there's a large waste output with too many horse group together, so there's stress. It's related mainly with stress factors. Stress factors include the population, nutrition, deworming, and caretakers, hygiene. So all these points determine the problems or the degree of percent of problems that I have with providing a number with the high takers, with good nutrition, leaving the horses loose. You will not see a problems. Okay. I think in Europe as well, it's not grouped. The farms are not grouped in a certain place. Everyone have its own property with large places. On the other hand, in Egypt, there's a certain place that you can find. Maybe in a place like a street, you'll find like 20 farms in the same street with high population. So there's certain places has high population. So when the places with high population comes the high risk or the high problems, more problems.
Good. Thanks for this overview and comparison between countries. So, is there any questions from our participants here? The good news is that we have a very good connection to Egypt and to Professor Shalabi is in the Cairo University. So, if anybody of you would like to visit Egypt for 3 months to learn more about Arabian horses, so there is an invitation, and we can get support directly from the university budget or from the DAD, and this will be a good chance for you. We can speak it later in other lectures. So if there is no questions, as I see it here, and I see nothing in the chat, so Dr. Ayman, many thanks for this overview. We have learned a lot today. Even we are working with mainly with infectious diseases the whole of our career. We have learned many things. The most important thing is management. Determining the risk is very important. We also have learned that Arabian horses is very unique, and they need a very unique, or you need to take care of really in a good management, using a good management system, and avoiding a problem or preventing a problem better than having a problem and control it. And I'm so happy that you have all this success in Zahra Farm and internationally. So many thanks, and we are very happy having you. So I will give you the last word before I close.
Okay, thank you. And it was an honor to be with you, sharing this together. And that's my goal. That, as you said in the last sentence, is that the goal of the veterinarian to prevent the disease, not only to treat. So that's why that should be, they should have the management system before giving the treatment and standing in front of a case. Thank you.
Many thanks to Ayman. So thanks for all of you, and thanks from also the participant here.
Thank you.
And we see you soon. Okay, the session is closed.
Thank you, doctor. Bye-bye.
Bye-bye, everybody.
Okay, bye-bye.